Hi, I'm Kelsie Timbie, and I'll be presenting a literature review of focused ultrasound for immunotherapy in gliomas. First, I'd like to note that there has been quite a lot of work using focused ultrasound for immunomodulation in other tumor types outside of the brain. I've listed a few recent review papers that cover some of those studies and clinical trials, but for today, I'm going to stick to brain tumors. One of the earliest questions that arose when we began thinking about focused ultrasound as an immunomodulator was how do different focused ultrasound modes affect the immune response? When discussing gliomas, there are several different modes that could be relevant, listed here, both in the thermal and mechanical regimes. Based on our understanding of how each of these modes affects biological tissues, we postulated that focused ultrasound may interact with the cancer immunity cycle in several different ways. First, the most obvious intersection involves the direct killing of cancerous tissues via thermal or mechanical ablation, the delivery of chemotherapeutic agents, or sonodynamic therapy. This cell death triggers the release of antigens, which may be enhanced by focused ultrasound in order to both strengthen the immune response and enable non-invasive tumor monitoring via liquid biopsy. Once the antigens are released, they are presented on the surface of dendritic cells for priming and activation of T cells. Some studies have also shown that focused ultrasound can be used to treat cancer tissue that is then used as a vaccine, enhancing this stage of the cancer immunity cycle. Activated T cells then traffic to the tumor, where they attempt to infiltrate the tissue. Low-power mechanical focused ultrasound protocols, like blood-brain barrier opening, can disrupt both the tumor vasculature and the stroma to facilitate this process. Finally, recognition of cancer cells by T cells can be augmented by immunotherapeutics, which focused ultrasound can deliver to the tumor. To better understand the ways in which focused ultrasound may interact with the immune system, the Focused Ultrasound Foundation funded a multi-site project to compare multiple modes of focused ultrasound in the mouse GL261 glioma model. Each mode was tested alone. The results are summarized here. Only thermal ablation provided tumor growth control. However, it did not significantly affect the immune response in the tumor. Hyperthermia increased infiltration of activated natural killer and CD8 positive T cells, as well as MDSCs. In contrast, histotripsy decreased MDSC populations and increased interferon gamma production. Low-power mechanical protocols increased the number and proliferation rates of CD4 and CD8 positive T cells and enhanced dendritic cell activation. This study demonstrates clearly that different focused ultrasound modes may have vastly different effects on the immune system. While there are several other ongoing studies investigating focused ultrasound for immunomodulation in glioma, I'm going to limit this talk to published work. One such study examined the use of hyperthermia for glioma treatment. In this paper, hyperthermia was used to trigger the release of extracellular vesicles, or EVs, from glioma cells. EVs may play an important role in the cancer immunity cycle, carrying signals from the tumor throughout the body. Hyperthermia increased the number of EVs that were released from the cells and modified their payload. When cultured with dendritic cells, these modified EVs upregulated interleukin-12 production in the cells, indicating that EVs produced by focused ultrasound may play an important role in the body's immune response to the tumor. There are also several published studies on the use of focused ultrasound to deliver immunotherapeutics to the brain. A multitude of papers have demonstrated that focused ultrasound can be used to deliver anything from a small molecule to a cell across the blood-brain barrier. While I'll be focusing on immunotherapeutic delivery, there are some great reviews out there that cover chemotherapeutic agent delivery across the blood-brain barrier via focused ultrasound. I've listed 3 recent reviews here for you. The first study I'll cover utilized focused ultrasound to deliver the cytokine interleukin-12 to the C6 rat glioma model. The results were quite promising, demonstrating significant increases in intratumoral CD8 positive T cells. There was also an increase in regulatory T cells, but the ratio of cytotoxic T cells to regulatory T cells increased. Focused ultrasound and interleukin-12 treatment also produced tumor growth control and a significant survival benefit. The next study combined radio-labeled antibodies and immunopet to optimize the delivery of CD47 to the brain, resulting in tumor growth control and extended survival. This paper went a slightly different route, using focused ultrasound to significantly enhance the delivery and distribution of intranasally administered anti-PD-L1 antibodies in the GL261 mouse glioma model. The benefit of this approach is reduced systemic toxicity, which is often a concern with immunotherapies. This study tested focused ultrasound's ability to enhance the trafficking of natural killer cells to a brain tumor. The researchers were able to demonstrate that focused ultrasound does indeed improve natural killer cell trafficking and infiltration, but that aggressive treatment must begin in early stage tumors to provide a survival benefit. You can see the two different treatment regimes in the figure, with one being front-loaded and the other more evenly spaced. The front-loaded regime delayed tumor outgrowth and provided a significant survival benefit, while the biweekly treatment did not. With that, I'd like to wrap up my talk. I hope it has been informative.